Bore da hi gyd, a croeso i'r Bwrdd Iechyd Brifysgol Aneurin Bevan. Good morning, everybody, and welcome to the meeting of the Aneurin Bevan Health Board. We will start today's meeting with a special meeting on charitable funds, with the board acting as the corporate trustee for charitable funds. Bore da hi gyd. Are there any apologies for absence? I'r Bwrdd Iechyd Brifysgol Aneurin Bevan. Good morning, everybody. Thank you. And welcome to the meeting of the Aneurin Bevan Health Board. We will start today's meeting with a special to the annual accounts and the annual report, with the board acting as the corporate trustee for charitable funds. Are there any apologies for absence?
Okay, thank you, Chair.
Good morning, everybody, and welcome to the declaration of the Aneurin Bevan
annual
Health
accounts and annual report.
We will start today's meeting with a special.
Happen post the sets of accounts and annual report. I didn't plan to sort of take people through the accounts in detail, mainly because we had a charitable funds committee on the 13th of January, where the committee went through the accounts and the annual report in a fair amount of detail. And as a result of reviewing them in the committee, they were happy to recommend these accounts and the annual report for approval to the board today. Probably just important to say that you will see from the accounts that during the year there's been an overall decrease in funds, and that's mainly because we've obviously had a concerted effort to try and use some of the charitable funds during the year. At the same time, it is also affected by things like the level of donations and legacies that we receive. We also invest some of the money as well, and I'm sure members will appreciate that during the last year and the previous year, changes in the stock market have been quite volatile, and of course our investments, although we invest in fairly secure funds, are to a certain extent affected by the sort of global stock markets as well. So the only other thing that I wanted to really sort of pick up was just to say that as part of the accounts, we have a note there around what's called post-balance sheet events. So these are things that happen after the end of the financial year, but that we want to bring to the attention of the reader of the accounts. So one of those relates to some of the TP price estate that we disposed of following that financial year. And obviously the other thing which I mentioned before is the COVID-19 pandemic, and obviously the impact that we've seen around that in terms of both donations and legacies that we've received during the course of this year, but also the way in which we will have spent some of that money this year. But that will come up in the accounts when we do them for this year. So I'll pause there. I don't know if Tej wants to say anything as chair of the Charitable Funds Committee. Before we sort of finalise this item, I would just like to say a few thanks, but if I can just pause there for a moment in case anyone has any questions or comments.
Thank you, Glenn. Have you any comments, Tej?
Yes, please, Chair. I'd just like to, I don't really want to add to the financial information that Glenn has just summarised very quickly. I would like to draw the board's attention and the public's attention to the annual report, which I think is particularly useful, not only for summarising quite clearly where funds have come from and where they've gone, but also to provide a feel for the kind of benefit that is realised from these funds that are given by all sorts of donors, from very, very small donations through to legacies. The kinds of work that is carried out includes volunteering, it includes supporting those with dementia, with specific services and equipment. It also includes various pieces of equipment that will come in particularly useful to staff, but also really benefit patients and their quality of their stay. So I really would commend this report, but also encourage people to have a look through it, because it really does give you a feel for the value.
Thank you very much, Tish, and we would all wholeheartedly endorse our real thanks to people who do donate and allow us to provide additional facilities to our patients and staff. Rhiannon?
Thank you, Chair. It was just a comment. I'd absolutely concur with what Tisha said. A really lovely report to read and beneficial. I just wanted to pick up, though, on a comment on the RETA units, which is on page 30 of 90 for admin control and page 4 in the report. It's just that there are general antibodies to the terminology suffering with dementia. Accepted terminology is people living through or people living with dementia. I'd just be grateful if that could be amended.
Thank you, Ray.
Thank you.
Paul?
Can I just sort of support what Tisha said? I don't serve on this committee, but having read all the papers and having read the auditor's report and everything else, and I'm happy to propose the report, by the way, I think it reads exceptionally well. And in particular, when you look at the work that's been undertaken to support patients in terms of their welfare, the equipment, the buildings and the refurbishment and staff welfare as well, and the research and the support costs, when you look at all that, it really is adding value to the work that's been undertaken. And so I wanted, and the one thing I did want to focus on was the volunteering and the fact that there's recognition of volunteering that takes place as part of that committee's work, and I think that's, you know, excellent, because so many people give so much of their time to support the hospital in all sorts of ways and within the community. And I think the fact there's some recognition events, I think also speaks volumes of how important we regard volunteering, as, you know, as part of the hospital is concerned, and for those who bequeath legacies, etc. So I just wanted to thank all involved. It's a comprehensive report. It's been well. There's a good report from the auditors as well, with some recommendations that have all been accepted. And if once it gets to this situation for a proposer for this report to be accepted, I'm happy to propose it.
Thank you, Paul. Are there any further comments? Tracey, do you have any comments on this?
Not to add to what's already been said. Thank you, Chair.
Thank you. Okay. So we can adopt and agree the accounts and annual report, and thank everybody very much indeed for the hard work in compiling this. Glyn, anything on the audit plan or the report?
No, I mean, I've got nothing to say really, other than that obviously the audit report, and it's called an ISA 260 report as well. This sets out the work that Audit Wales have undertaken. Although they identified one or two sort of small issues, they've been able to issue an unqualified opinion on the accounts, which is good. Yes. I don't know if Tracey wants to add anything to that in terms of Audit Wales' opinion, but the only thing I'd really want to finish by saying is just to thank Audit Wales, the committee members and our charitable funds team for the work that they've done on this, particularly sort of closing the accounts and auditing the accounts during the middle of a pandemic. So really appreciate that. Thank you.
Yes. Thank you very much, and we endorse those comments too. Tracey, do you wish to add anything?
Sorry, would you like me to take you through the ISA 260? I'm more than happy to make some brief comments on those reports if you wish.
A brief comment would be valuable, thank you.
Okay, thank you. With regards to the audit plan, that's just here for completeness. As you're aware, the most important document is the ISA 260, and as Glyn has already acknowledged, we have proposed an unqualified opinion on the charitable funds accounts. There were a couple of matters that we've included in the ISA 260, and there's some detailed recommendations in Appendix 4, really just to make some improvements and strengthen the processes that are in place. And it's really pleasing to note that that management have agreed those actions, and some of which are already in train. Some are going to be a little bit more difficult to get going, as in the time it will take to complete. So I think one of the deadlines is for sort of near enough a year to 18 months to actually put in place, and that was really about the streamlining of the number of charitable funds that the health board has. But no, just to reiterate what Glyn says, really a big thank you to everyone involved. It has been a challenging year. What we learned from auditing the main accounts, we applied to the charitable funds audit, and I think it worked well. So again, just thank you to all officers concerned.
Thank you very much, Tracey, and thank you very much for your cooperation, working so positively with us. If there are no further comments, can we adopt the annual report, the accounts, and note the auditor's recommendations, which we will of course progress. Is that accepted?
Yeah.
Thank you, and thank you very much to all of you. If we now might please move to the main part of the board meeting. This, as I will remind you, is being live streamed on our YouTube channel. I'd like to start by acknowledging the enormous effort being made by our staff and volunteers in respect of COVID, in terms of caring for really ill patients, changing roles to help, working in our test and trace system and in the vaccination centres. It is really, really appreciated by everybody. Everybody is so incredibly busy and hard pressed, and we thank you all so much for your care and attention to your communities and to the patients. And I need to note that local government and the health board and voluntary organisations are working really, really well together to deliver services and protect the communities. So on behalf of the board, I should like to thank all of you so very much for the job that you are doing under difficult circumstances, which we really appreciate. However, our thoughts must also remain with those who have and are currently battling with this dreadful virus, and with those whose loved ones have very sadly died. We remember you all, and we wish you the best for the future. Might I start the board meeting by welcoming Professor Sweetland as the University Independent Member and James Calvert as our new Medical Director to their first meeting of the board. We're very pleased to see you with us today. Might we start then with apologies for absence? Have we any?
No, Chair.
No, thank you. Declarations of interest on any of these issues?
None today.
None today, thank you. Might we take the draft minutes of the meeting held on the 16th of December, please? Are there any amendments?
No.
No?
Chair.
Yes.
One from myself is Rhiannon.
Oh, Rhiannon.
Thank you. It was just in relation to the Nurse Staffing Levels Act, which was on page 10 of 14, item 16.2. It actually identifies that professional assurance was received about right staffing levels, that the right staffing levels were in place. The assurance was given in relation to compliance with the Staffing Act, and that all efforts are being deployed to secure appropriate staffing, but obviously COVID has had a significant impact. So a subtle change, but an important one, please.
Fine, thank you. Are we all happy to accept Rhiannon's recommendation?
Yes. Yeah.
Okay. Are there any other amendments?
No.
Are there any matters arising that aren't in the action log?
No.
I think, Shelley, you had a question.
Yes, sorry. Yes, I did. It was just on page 2 in reference to the satellite radiotherapy centre. It says there that obviously you'd had discussions with the investment funds, etc., at board at the Welsh Government, and I just wondered if there was any update on where we were with the decision on that.
Nicola?
Yeah, thanks, Shelley. Good timing on the question. So we went to Welsh Government on the 9th of December, and we had formal confirmation yesterday, I think, or Monday, that the outline business case has been approved, and he's agreed for us to now progress the full business case stage. So really good news on this project.
Excellent news. Thank you, Chair.
Thank you very much. It is indeed excellent news. Nicola, you're a little difficult to hear. If you could put the volume up a little. Thank you. Thank you very much. If there's nothing further, Paul?
Anything on the Medipark?
Yeah. Nicola?
Nothing further to update since the last meeting, other than a meeting has been arranged with Welsh Government officials in order to agree the next steps for this project.
Thank you.
Can I say?
We'll have a report further.
Can I say congratulations on the satellite radiotherapy centre? That's excellent news for the community. Yeah, well done.
Yes.
Well done.
We currently, because it's obviously just hot off the press, I will work with Karen in terms of our communication, broader communication on this scheme, alongside the breast unit that we recently had approved as well. So.
Yeah, that's really helpful.
Good. Well, it is really, really good news. Make a huge difference to the population and their access to care. Good. Thank you. Could we go then to the action log, please? Richard?
Yeah, the action log, we have 3 actions. 161208, it's about adding the People and Culture Committee to the schematic. That's been completed. And then 161212, we've got primary care estate strategy to the PSBs, and I think Nick Wood will update on that. And then 161217 about performance report. I think Glyn has included that in his report.
Yes, thank you. It's really helpful. Nick, would you like to advise us?
Yeah, just to update, Chair, there is a plan in play to try and share the estate strategy with all the PSBs as we move into Q1 of the next financial year. So I'm hoping to get that scheduled with all of them for their next available meetings.
Thank you. Good. Well, if there's nothing further, if we move on to 1.6, report on sealed documents and chair's actions. Richard?
Yeah, there were 3 sealed documents. All about, one's about land transfer in Chepstow, and 2 were about mass vaccination centres. And there were no chair's actions in this period.
Thank you. Has anybody any questions on that? No. Thank you very much. 1.7, the chair's report. And a number of since we last met, a number of meetings have been held with Minister and local authority leaders in Gwent and in South Wales about COVID and its effects on communities and the pressures in the system. So he's been making sure he's learning firsthand what it feels like in our communities and how we're coping. We have been joined by our chief executives in that, who've been invaluable in providing the detail. I've also had fortnightly and ad hoc meetings with local authority leaders in Greater Gwent about COVID and mutual support, and these have been extremely positive meetings, I have to say, with a huge unity of purpose and action throughout the area. I have also met with Welsh Government officials about revised governance arrangements, because they are looking at identifying governance lessons which can be learnt from the response to COVID and the different way in which we've conducted our business. And I was grateful to see the very positive report from Audit Wales on our own internal audit on the effectiveness of those actions that we took. They're trying to develop a board maturity assessment tool, and they're looking at a best practice board development toolkit. for the future. So the chairs and the chief executives, as the accountable officers, are helping them form those 3 pieces of work. The chair's peer group, as usual, met on a monthly basis, and we obviously discussed health protection and vaccination. We also discussed the establishment of the NHS Confederation's Race and Health Observatory, and we had the leader of that come to give us a talk. Their work programme will be published this week, and I will circulate that to the members of the board for further discussion. We have looked at the issue that has been raised now by Welsh Government in terms of integrated governance in an urgent unscheduled care system, which Dr. CDV Jones, the chair of HEIW, has been asked by the Director General to lead, and we will see what happens. That is all about, you know, if this is quite a complex system, so who actually is ultimately responsible, and how do we make sure best governance can, in the interest of patient care and safety, might be exercised. We obviously discussed ambulance handovers, and you've seen the results of the ambulance handovers in our performance report. And then we had a presentation again from the Confederation in London about economic and social recovery after COVID, the role of the NHS organisations in that as an anchor organisation because of the numbers of staff that we employ and the apprenticeships that we can offer. That will be taken further because we need within Gwent to discuss in great detail the economic and social recovery of our communities. And I will send you the slides that he presented to us when I received them. In terms of partnership working, the Regional Partnership Board for Gwent has met on 3 occasions, 1 regular meeting and 2 special meetings. So the regular meeting obviously took on board our present consultation on transforming adult mental health services and went down very well indeed. We discussed COVID, and we also discussed the Integrated Care Fund and Transformation Funds and the Winter Protection Plan. But it had been decided that we should have 2 special meetings, one on integrated care funds and the evaluation of the schemes, including the establishment of added social value arising from them, which indeed we did, and further work is being undertaken on that. And then one last week on the transformation schemes, we thought, but it turned into a facilitated session on place-based care and the role of the RPBs, integrated strategic partnerships and neighbourhood care networks in the future development of our services for the community. And a full report on that will be available to you, which I shall circulate when it's received. Lastly, as you all know, a white paper has been published on improving social care arrangements and partnership working. We will have a board briefing on this, and our response to this white paper will come back to the March meeting of the board. It's a far-reaching set of propositions, and I've been involved on behalf of the chairs as the lead chair, and the chair of the vice chairs meetings and the lead chair of the NHS chief executives in meetings with the deputy minister who is promoting this white paper and local government leaders in discussing the proposals. And we were very pleased to see that some of our input has been reflected in that white paper about ensuring quality is put at the head of our commissioning programmes, and a summary has been circulated to board members, but we shall return to that in the next month, as we need to be able to be in a position, or an informed position, to respond to the government on this really important white paper. I don't know if anybody has any questions.
Well done.
Thank you. If not, could we pass on to section 2, and the COVID-19. Judith.
Yeah, thank you, Chair. And in a moment, we'll give an update on the mass vaccination programme, which I know will be of interest to board members, but just a few other points to just share with the board before that item. I think in terms of the health board, it has been an incredibly busy time, as you mentioned, Chair, since our last meeting. I think now in terms of the current position, in terms of COVID transmission in our communities, I think we are now starting to see a sustained reduction in community transmission across our health board area, which is a really positive to see. As of yesterday, the most recent published information within the Aneurin Bevan health board area, we were at 201 cases per 100,000 over the last 7 days, which was below the Welsh average, which was 218. And in all our local authority areas, we've seen consistent and sustained reduction. The only area within our boundary that is now above the All Wales average is Newport, and clearly we're continuing to keep a close eye and working with the incident management team to make sure that we're doing everything possible in terms of the transmission in that community. The other thing to note, obviously, is that the positivity rate has continued to reduce as well, which is really pleasing to see. And again, the positivity rate in Aneurin Bevan is below the Welsh average positivity rate. And I think we probably would be appropriate as a health board to thank our communities for their compliance with the regulations. I think we acknowledge that the vast majority of our communities have been complying with the restrictions and regulations introduced by the Welsh Government, for which I know we are incredibly grateful. In relation to COVID cases in our hospitals, this has also continued to reduce. As of yesterday, we had 338 positive inpatients in our inpatient settings. We had 120 who were suspected and awaiting test results, 172 now recovering from COVID, but 889 non-COVID patients. I think it's really important to remember, whilst we often focus on the COVID patients in our hospitals, we continue to have many more non-COVID patients in our hospitals. And I think it's important to acknowledge the totality of the care that we are providing to people across our settings, whether hospital, community and in primary care. I know board members are often interested in the numbers of patients in our intensive care units. As of yesterday, it was 26, 17 of whom were COVID positive and 9 were non-COVID. So that's just a summary of the position. In our previous meetings, we've also talked about workforce constraints. And as the board will know, 85% of the people who work in Aneurin Bevan Health Board actually live in our area. So it's important to recognise that any COVID that is transmitting in our communities will impact on our staff and their families. But pleasingly, in the last week, we have seen our overall staff absence reduce. It is now at 9.3%. down slightly from just over 10% the week before. So I think that's good to know. I would remind the board, however, that 9.3% does equate to 1,152 whole-time equivalent staff who are not available to work. And in terms of individual members of staff, that's 1,383 people. We do have a number of staff who are redeployed across the health board into other roles and priority work. And I recall Chris Coley asking at the previous meeting about how we would make sure we continue to provide those very important functions, including our test, trace and protect service and our COVID vaccination programme. And we are continuing to do that. And we are very, very grateful to staff who are agreeing to move into those areas to support those efforts. It is really important, and we are increasingly grateful to them. Registered nurse workforce supply has also been a constant concern to us, and we are now seeing that to slowly improve, but nowhere to the level that we would want. And the work that Rhiannon is leading with the senior nursing team in terms of recruitment, retention, and the introduction of overseas nurses into our facilities continues to be very important indeed. I'm not going to say much about the vaccination programme because I don't want to steal the thunder of Sarah, and I know Mez Foley has joined us as well, so I'll say nothing more on that. Also, Anne, just to echo your comments, that often we talk about numbers in the health board, but we know COVID has touched the lives of many people in our communities in many ways, not least those who've lost family members and friends and colleagues through the COVID pandemic. And we do really need to acknowledge and remember that COVID has brought huge sadness to many people across our communities, and it's important that we acknowledge that. And just a final thanks to all the staff across the health board and also to my executive team colleagues. People are working tremendously hard to try and fulfil all the things we need to do and want to do to keep our communities safe and to support the care of patients across our system. We are immensely grateful for the support of our partners, the third sector and our communities. And I just wanted to acknowledge that, and thank you very much.
Thank you very much, Judith, and we thoroughly endorse your views. Are there any questions before we move on to the mass vaccination programme?
Just one, Anne, if I might. Just to say, huge thanks to all those that have been involved. I mean, I totally agree with Judith, but part of our role, Judith, is as a duty of care over all that work for us. Is there anything more or anything we can do to support you and your teams across the health board with regard to your work at all? Because today's an opportunity for us to consider any support or anything else that you feel that we can do to help you with this very difficult time.
That's very kind of you to ask, Paul. You'll know from conversations and discussions we've had previously that the well-being of our staff is absolutely critical to us, and I know the board shares our views about that in terms of the additional investments we've been able to make in well-being support. And a message constantly to our staff is to look after themselves, but to look after each other as well. It's a very, very challenging time, and making sure that we support staff and we visibly support staff. In other words, it's not just words, but in actions as well is really important. So thank you for that. I don't think there's more we can do, but we are considering constantly the well-being offer we make to our staff. And I think there is the potential for some further support into that over the next few weeks, which we might come back and share with you.
Yeah, that's great. Thank you.
Thank you. Are there any further questions to Judith? Might we move then, please, to the mass vaccination programme plan, and Sarah?
Thank you, Chair, and I'm very grateful to Mez for joining us because she is the expert on the subject of the mass vaccination programme. The board will have received the weekly newsletter on Monday and will know that we are making very good progress through the first 4 priority groups. But with that broad introduction, I'll hand over to Mez to provide more of the detail. Thank you, Sarah. Mez?
Okay, thank you, Chair. Thank you, Sarah. Good morning, bore da pawb. So this purpose of this report is to give you an update in respect of the progress of the rollout of the programme, which we commenced on 8th of December. In terms of the data included in the report, that was as of 18th of January, and I'm sort of pleased to give an update that as of end of play yesterday, the health board staff have given over 50,000 sort of vaccines. So 50,000 people, just over, have been vaccinated by the health board since the start of the programme. And in terms of care home for older adults, 89 care homes where residents have been offered vaccinations have been completed, and staff in 90 care homes have also been sort of completed. And the programme is working to follow JCVI priorities 1 to 4 by mid-February. You'd also note in the paper that I've made reference to the 30th of December, where the 4 chief medical officers across the UK issued a joint statement relating scheduling of doses and the extending of the second dose from an interval of 28 days to 12 weeks. As a programme, we adapted urgently to that at the beginning of January, which meant that we postponed thousands of appointments and rescheduled those appointments beginning of January for first doses in terms of how the programme adapted to meet that joint statement. So the aims of the programme, the Welsh Government have issued a COVID-19 vaccination strategy with the intention to vaccinate all priority groups 1 to 4 by mid-February, subject to vaccine supplies. And then by the spring, the remaining 5 to 9 JCVI groups will be offered vaccinations. That includes everybody over 50 and in at-risk groups. And then by the autumn, rolling out then to eligible adults according to JCVI guidance. So in terms of Aneurin Bevan programme objectives, our aim is to maximise population health and reduce adverse impact of COVID in Gwent by providing vaccination in communities to eligible workers and residents in the quickest possible way, and also safely as well. And also we need to ensure there's there's quality and safe care of those attending the programme through our mass vaccination programme. In terms of our progress, in terms of working towards mid-February, that we have got a plan in place and we're making good progress towards that plan, and we intend to meet mid-February subject to vaccine supplies, but also noting that the N priority group 2, the health and social care frontline workforce, is a fluid group in terms of numbers. Due to changing 75 years and over to 79, we will be inviting the cohort to mass vaccination centres, and then the age 70 cohort will be divided between general practice and mass vaccination centres. And general practice will focus on individuals who fall within the clinically extremely vulnerable group, so they're the shielded group. So the paper also outlines the risks in terms of delivery currently as well. It is agile planning according to vaccine supply and the different types of vaccine. And the colleagues would have made reference to the AstraZeneca and also the Pfizer vaccines are very different vaccines in terms of how we can deliver those, and the Pfizer is delivered through our mass vaccination centres, whereas the AstraZeneca Oxford vaccine can be delivered through primary care as well as through mass vaccination centres currently. So I've made reference to main risk in relation to sort of workforce, the just-in-time arrival of the vaccine supply and agile planning process for inviting residents into appointments, and also how we're adapting the programme. And I've made reference to a further large venue opening for Pfizer, and since I wrote the paper, that one will be opening this weekend in Newbridge. So sort of want members to note the progress in implementing of the plan since we started on 7th of December. Thank you.
Thank you, Mez. I have a number of questions. Paul and then Tej.
First of all, can I congratulate all those that have been involved with the vaccination process. I think I've spoken to about 8 to 10, it is 10 actually, 10 people who are over 80 who are friends or family, etc. And all of them, without exception, have been exceptionally positive about the way that the whole system has handled and the way they were treated and the fact they've been vaccinated, and they are greatly appreciative of all the work that's happened with regard to that. So I think that's a very positive comment to pass on to all that have been involved. The two questions are, one is on supply. Where are we with regards to supply? Because taking up the media at the moment, there's been all sorts of issues about whether or not the EU are going to allow AstraZeneca to send medication over to the UK. That's question one. And the second question is, what's the current situation about the 2-dose vaccine, and as to whether or not the key message about when are people going to get the second dose, or is the approach that everybody should get the first dose? Just to perhaps clarify those two, if you could, that would be really helpful.
Yes.
Okay. Yeah, thank you. So in terms of supply, so Welsh Government secures supplies and then allocate our supplies to us. So we are confident in our Pfizer supply, and then we have predicted supplies for Oxford, which Welsh Government confirm on a weekly sort of basis. In terms of the interval for dose vaccines, so we have been advised that the second dose will be administered 11th or 12th week, and we are working towards that as directed by the CMO in terms of timetabling the second doses from about mid-February onwards.
Great, thank you for that. That's really helpful.
Thank you. Tish?
Thank you, Chair. Firstly, just to add my congratulations. I mean, it's a mammoth effort in a very, very complex environment. I will just add that I did visit one of the mass vaccination centres last week in my capacity as a trustee of Newport Live. I went to visit Newport Centre, and I was particularly impressed by the collegiate working and the very the seamless way in which volunteers, staff at Newport Live, and Aneurin Bevan Health Board staff, the armed forces were all working entirely seamlessly.
Do you wish to add anything, Sarah?
Anne, it's Chris Coley here. Could I just ask a couple of questions? One is just
certainly.
One's a comment rather than a question. Just following up on Pippa's point about unpaid carers. It's quite right that a lot of unpaid carers don't have carers allowance, but Carers Trust and Carers Wales do have information on carers, and they do have a database, so that might be worth considering for when we do get to that category of people. My question was, and it's one that I've asked before and had a positive response, but around the risk of workforce, it doesn't seem that is an issue at the moment, and I was particularly referring to media reports about the training requirements preventing the workforce from coming forward. I just wondered if that was still the case.
If I may come in on that one, Chair, because I completed my training and started vaccinating yesterday, Chris, so I can, with confidence, give you the answer that it's proportionate to the task. Because it is about, it's a new vaccine, we need to do it safely, so there does need to be some robust training, but the approach within the Health Board is entirely proportionate. And very good, I have to say. It's a long time since I vaccinated anyone, and I felt very confident in the process and was well away by the end of the day.
Okay, thank you, Sarah.
Geraint, do you want to add something?
Diolch, Cadeirydd. Thank you, Chair. I was just wondered whether you wanted me to reflect on some sort of issues that we've run into in relation to the programme, which is sort of understandable given the scale and the pace of the programme. Would you like me just to touch upon some of those issues? So I think in terms of, addressing your point, Chris, about resourcing, I think the generally redeployment of staff during phase 2 has been more difficult than in phase 1. And there's a number of reasons for that. So Judith mentioned earlier the continuing high absence levels. We've got an underlying level of registered nursing vacancies. We've got staff who are exhausted from responding to phase 1 and are understandably less receptive to the concept of redeployment. And more of our services are being delivered now than they were under phase 1. So I think a combination of those things makes redeployment a little bit more difficult than it was under phase 1. Fortunately, we've, under the national protocol, the people able now to vaccinate has been widened to include clinical non-registrants. So that's a major development, really, because that does broaden the scope somewhat. But in terms of external recruitment, we've had some issues that we've had to deal with. So we've favoured employing people on fixed-term contracts because that gives us a more sustainable workforce solution. But unfortunately, not everybody and a lot of people haven't favoured the fixed-term contract approach, preferring casual sort of ad hoc hours. So we've had to adopt our approach to reflect that and to have more flexible contracts. Under the furlough scheme, individuals are looking to work outside their normal paid hours. But if they're prepared to volunteer on an unpaid basis, we've had to develop collaborative agreements with their employers in order to cover off employer indemnity and the patient confidentiality issues. So that's another sort of barrier that we've had to overcome. We found that with the reintroduction of shielding, that many of the volunteers that have put their hands up to help, quite a few of them actually fall into that category. So when we've contacted them, we've found that a number of them are shielding. So obviously we've had to take that into account. And I think it's fair to say that our normal recruitment processes were not able to deliver the numbers that we need with the speed that we need those individuals. So we've had to develop some new recruitment pathways and in order to significantly reduce those timelines. So we've done that with the agreement of the executive team, and they've already been implemented. And we're working closely with shared services to make sure that the journey from start to end, so right through to payroll, is actually as seamless as it possibly can be. So I think that we have run into some issues, but I from my perspective, I think that's understandable given the scale and pace of this programme.
Yeah.
Diolch, thank you.
Thank you, Geraint. I think that was a very helpful reflection on the difficulties that we are all facing. Are there any further questions on COVID or mass vaccination?
And yep.
Oh, sorry, Ree. Yeah.
That's okay, thank you. It was just to add to what my colleagues have said, but Chris will have been aware of the response we've given previously in relation to the training, and that we weren't really getting much noise from an Aneurin Bevan perspective in relation to the intensity of training, but it was 16 modules that you had to complete. It's just for the board to note that we have led a programme of work to reduce that demand quite significantly to now 4 modules, and I'm pleased to say that is being taken to the National Vaccination Group tomorrow for national adoption, so that's made it significantly easier in terms of time and pace for people to complete the programme. We've also signed off a governance framework, and as Geraint said, that does focus on people with clinical experience, albeit non-registrants, but we are being quite flexible around clinical experience. So for example, we've had quite a lot of contact from the airline industry with people who have got quite a significant amount of experience in dealing with clinical situations, and we're working with colleagues to embrace them into our programme as well. So we haven't had issues in terms of a demand and capacity gap in terms of both staff and the training. Thanks.
Thank you very much, Ree. Thank you. If there's nothing further, well, congratulations to you all. This is a massive logistical issue, but is so important to the population, and people, I would endorse the view that people are so thrilled to get their vaccine and how well it's all been organised and how safe they felt, which is really important. But we obviously need to stress that even when vaccinated, care has to be taken in terms of adhering to the guidelines under which we live at the moment. So thank you all, Mez and your complete team, and Karina, for the work that you've done to get this as smooth as humanly possible. So thank you. Might we move on to items for decision, please, and the South East Wales Vascular Surgery Network. Nicola.
Thanks, Chair. I'm just checking, is my sound better?
Shout.
I'll have to shout. Okay, so this paper relates to the regional work that's been underway for vascular services across South East Wales. The Joint Vascular Programme Board has recommended that the services move to a networked arrangement with a hub and spoke model, with the hub being recommended to be at the University Hospital of Wales in Cardiff, and spokes at the Royal Gwent Hospital for Aneurin Bevan, and then other hospitals for the other health boards. The next step in this programme of work is to embark on a period of formal engagement across the 4 health boards that would be affected by this, which include ourselves, Cardiff and Vale University Health Board, Cwmtaf Morgannwg, and Powys Health Board, as well as the commissioners of those services representing their populations. As will be identified in the paper, work has been underway for some time around this service due to some of the sustainability risks and the evidence base around centralising services based on our population size and so on, and the lack of a previous formal network arrangement, which is quite unusual for this type of service. So good progress has already been made across the region, particularly in terms of some of the out-of-hours arrangements and more recently interventional radiology, which is linked to this service as well. There's been clinical consensus across the 3 provider health boards, us, Cwmtaf Morgannwg and Cardiff and Vale, that a centralised model is the right one, in line with guidance and standards, and there is consensus that the hub would be located at the University Hospital of Wales, which has been even more strengthened recently to co-locate with a major trauma centre. So very much the guidance on changes to NHS services in Wales generally recommends a 2-stage process, starting with engagement and then leading to consultation. The Vascular Programme Board took a report in October 2020, considered the approach that was being recommended, and recognised we needed to have that appropriate engagement with the Community Health Council, councils across all of those areas. So the scope of the engagement phase has been set out in the paper, which you can see is informing people what vascular services are and how they're currently organised, explaining the challenges that face these services, engage in discussions about the potential and only viable option and aid the understanding of that, and hear what is important to people in this discussion before a period of formal consultation. And you will see attached as well a detailed discussion document and further questions that are posed, recognising given the clinical work and option appraisal has already been undertaken, it is a good opportunity to explore this further, or perhaps beyond a normal engagement phase. And you will have seen the discussion documents and some of the easier read, the presentation format as well, that will help with our engagement with the population on this issue. There's a potential timeline attached in the paper, which the key one is all of the health boards will be shared in the same documentation at their board meetings this week, which would enable us, subject to approval, to start engagement from mid-February and bring in the outcome of the engagement back to the individual health boards at the end of May. And subject to approval at those stages will take us up to a period where, following consultation, and we'll come back to boards in September this year as well. There's also some information around the different stakeholders and the products that we would require. And as you can see as well, there was a meeting with all the community health councils on the 13th of January, at which point there was very explicit support from the Aneurin Bevan Community Health Council, and Angela's been very involved and helpful on this throughout some of the work we've been doing on this service for a number of years, as well as Cwmtaf Morgannwg Community Health Council. And there were further discussions due to take place between Powys and South Glamorgan CHCs, which have both happened since that meeting. Powys was last week, I understand, and was agreed. And yesterday the meeting was with the Cardiff CHC, who were hugely complimentary of the documentation and the process, and were recommending to the executive. It's just being formalised in writing today, and they'll be feeding that into the Cardiff and Vale Health Board meeting, which I believe is tomorrow. So there is now consensus and support across all the community health councils around this documentation and this process. So that's just a kind of an overview of where we're at. We're asking the board to note the background and the clinical discussions that have been going on for some time in relation to this service. Consider the proposed focused engagement and the discussion documents that have been attached and the timeline, and agree that we will receive our engagement then back at the May meeting. And so whilst it's probably important to say that whilst this will be coordinated by the Regional Vascular Programme Board, it is the responsibility of each local health board to undertake the local engagement work. Okay,
thank you, Nicola. I think that was very clear. Huge amount of really hard work has underpinned the development of these proposals, I have to say. And I'm very pleased to hear that South Glamorgan was so complimentary, as I know they had some concerns when it was first mooted to them. I have a number of questions. Pippa, Paul, Shelley.
Thank you, Anne. Yes, I have a couple of comments and a couple of questions. The first thing is I think it's an absolutely excellent paper. It's very clear, and I was particularly pleased to see things like the jargon buster in there, and I really think it really laid some great groundwork for engagement. There were a couple of comments that I had, and they're not so much questions really, but they are comments. One of them is around the kinds of broadening your engagement and contacting those groups of people who don't necessarily have access to digital platforms. And there's a comment about supermarkets, and I wondered whether or not there was a plan to roll out to the kind of more smaller local supermarkets that where we might be reaching into greater demographics. So, you know, your kind of Spar, Premier, those kinds of shops. So that was the first one. And the second point really is around raising the profile of obesity within this paper, because it's something in the Healthy Weight Cymru strategy from the government that is a real priority area. And I just think that this is another way in which we can raise the profile. And I noticed in one of the lists that it came behind smoking, for example, whereas actually we probably, and people tend to view a list as being a list in priority, even if that's not the intention. And so I guess it was just my kind of comment on engagement of how do we really reference that within this document. So, but as I said, great inclusion of case studies and a really excellent paper. So, and I fully support it. Thank you.
Thank you, Pippa. And Sarah, did you wish to help with an answer to that?
Thank you, Chair. Before the pandemic, my life was leading the Healthier Gwent strategy, building on my annual report in 2018. And in their paper, I specifically included the proportion of the risk factors that account for cardiovascular disease. So it is the case that smoking is the biggest risk factor if you are a smoker. So I think that we have to get that balance right. And there are parts of our population where smoking really is, becoming very low indeed. And in those populations, clearly the emphasis does need to be on healthy diet and physical activity, because those two things are independent of obesity. And I think that's the second important message, that for vascular disease, nutrition and the appropriate diet is a very important part, and as is physical activity, is probably even bigger risk or mitigation of risk. So I think it's I think it's referring people back to the analysis that was in my Building a Healthier Gwent report, and hopefully later in the year we can get back to the momentum we had built around that, and particularly, as was said at the previous board meeting, everything about the pandemic is widening health inequalities. So you're absolutely right that the pandemic has drawn attention to the impact of obesity, but specifically on vascular disease, technically smoking is the bigger risk factor.
Thank you, Sarah, for that helpful explanation. And have no fear, A Healthier Gwent is on my forward work programme. It will not be lost, so we will be pursuing it. Could I have Paul, Shelley and then Angela?
I endorse what Pippa said. I think this is excellent. Very comprehensive.
Paul, you're very, we can't hear you.
Okay, I'll start again then.
Please.
Thank you. It's an excellent and comprehensive plan report, and I fully endorse all that's been said. What's really good is that it's joined up and there's an agreed approach across the South East Wales boards, and also very useful discussions with the Community Health Council. And we're very fortunate in Gwent to have such a supportive and critical friend with regard to the Community Health Council, but they've been very supportive of this approach. I think it is important to move this issue important to move this situation on and to get resolution. This has been talked about for many years, and what I think is so encouraging is we are now at the stage where we could get a reality in place within a reasonable amount of time. So the engagement process is going to be important. We need to be creative and innovative. We need to capture the views of patients as much as we're able to get as much evidence together, so this does become a reality, because this model of working and the joined up approach, I think, is incredibly important. And I think the engagement work together with the support from the Community Health Council, and also utilising the work from our excellent communications team, I think all together, let's get the report produced, ready, so we can move this on to the next phase and to see this actually happening rather than being talked about.
Thank you, Paul. We endorse that. Shelley?
Thank you, Anne. I'd like to just endorse what everyone else has said, and also congratulations for getting this to us, and the collaboration around it is probably one of the first I've seen, coming together in this way. So I think congratulations to Nicola and her team for getting it all together. And I also think that the case studies in the document bring it all to life. So I think, again, that is, really, really important. I've got just one point of detail, Anne, if that's okay.
Yeah.
So on page 47, under the lower limb bypass angioplasty and stenting section, there's a paragraph that states that there are challenges with validating data in these areas with Aneurin Bevan, so that volumes are likely to be much higher. So I wondered what the reason for that was, but also what does much higher mean? So are we more likely to be nearer the Cwmtaf figures? And has this additional volume been factored into the business planning process?
Thanks, Shelley, and thanks for the feedback. So this particular issue is probably because of the coding of some of our procedures, where lots of this has been lost within general surgery as a general capture. So our vascular surgeons are looking at some of the coding of this, and we can do an audit to try to identify some volumes, because they don't look quite right as kind of as set out in that table. You would expect us to have a higher number than generally based on our population size. So that's why I think it's being queried, because the numbers don't reflect what you'd expect from a population basis. So there's work going on to try to validate that, and that's some of the extra work we need to do in terms of the spokes as well, so that we've got better, we do an accurate kind of costings as well as planning for capacity, by making sure we address some of these anomalies in our coding.
Thank you, Anne. Thank you for that response. So hopefully we'll be able to use some funding, if we get any, on digital to go to the robotics to get the coding stuff perhaps a little bit more automated. That might help us as well.
Well focused. Right.
Thank you.
Yeah, and there is an important informatics component to this project in terms of making sure that we can access good information across the region. So that's a key part.
Yeah, thank you. Angela, and then T.
Hi, thank you. Yeah, just wanted to say there's an excellent piece of work, and it's really clear for the public to understand. And what's really pleasing is that the team have been able to ensure that people who are IT, have the IT ability, can engage, and those that don't have the IT abilities or equipment are also able to engage in this process.
Yeah, well done.
Thank you, Angela.
Sorry, so my IT went there. I just a point of clarity. Myself and my chair fully support the document, but I do need ratification from my executive committee, which will take place tomorrow. Right. But I don't see any problems there. Thank you. Sorry.
Thank you, Angela, and thank you again for the support you've provided and the sort of facilitation that you've undertaken on a collective behalf to ensure that the board of the CHCs in Wales could endorse the approach that we're taking. It was really helpful. Thank you. Nicola, do you want to add anything to that?
Yeah, I just think it's probably, I can say it at the end, but it's important now with Angela's comment that I just want to formally note the thanks of Claire Harding, who is from my team, who has played the key role and taken the lead on behalf of all the health boards in getting this documentation pulled together. She is leaving us this week to take up a new role in WISC, so I think it's opportune to recognise the work she's done on this particular engagement process.
Yeah, absolutely.
So she's very close with Angela and the CHCs on that.
Yeah, she has done a splendid job on this, I have to say. Tej, and then Empress.
Thank you, Chair. A few of the questions I had have been answered, but just quickly, excellent document. I think this is the clearest I've ever seen a case made in respect of why it is that we are looking at changing services in respect of clinical benefits and outcomes. Obviously, we've seen a lot of consultation documents over the years, but this one for me really nailed it so that the public understands that this is about outcomes. This is about what value the individual is going to get out of this change. What I'm wondering, and this is not something that we do, but to balance that, I'm wondering why we don't, or I accept the challenge, but I'm wondering whether some kind of indication of resource implications would be helpful for the public. And part of that, when I say resource, I don't mean human resource, I mean ones with pound signs in front of. Part of that is when I see consultations go out and I see the redesign of services, I also see some of the population feeling that this is about money, saving money. Of course, you would put everything together because it costs less. And I think a deep reassurance that is not what we're looking at. What we are looking at, as I said, to balance, to counter that argument at the outset, I think would be helpful. In respect of the document itself, as I said, I think it's excellent. I still do think we've got a little way to go in terms of making it very clear and easy reading for people who aren't familiar with the jargon. If you look at the equality impact assessment, which I also think is good, and compare the document with some of those people who are impacted and whether they will understand some of the jargon. Clearly, some of it is clinical referencing, and it's great to have a glossary of terms in there. But I think that we within the system are used to certain jargon which is represented in that document, which would switch people off, that people wouldn't necessarily continue to read. I do think it's an excellent document, but I still think we've got a little way to go.
Thank you, Tej. Nicola?
Yeah, thanks, Tej. And we'll pick those issues up and we'll continue to reflect on how we can make them easier for the reader. I think on the finance side, I completely agree. And the plan is that we will have more financial information at the consultation stage on the basis that some of the finances are not fully worked through. And, we need to underpin some of the data around the activity numbers at the spokes in order for us to do that properly. There has been some previous work done on the finances over the last few years. And I think, your point is well made, is that we need to make it clear up front. This is about improving outcomes across the region. This is not about saving money. And I think when the final case comes, it'll actually show that it's probably going to cost some money to improve the outcomes across the region. So I think the consultation absolutely will need to set out a bit more around the value for money, you know, in terms of the additional cost, but for the improved outcomes that will come from this project. So yeah, that will hopefully get picked up at the next stage, but it's a very valid, important point.
Just to be clear, I do think it's absolutely excellent in respect of setting out the improved outcome. So it's just that extra bit.
Yeah.
Thank you, Tish. Thank you. Emrys?
Yeah, one's a comment, one's a question, Chair. Obviously, from my perspective, full support of the clinical model. It reflects best practice and the evidence base, and it's been very well presented within the document. Maybe my question is a little bit similar to what Shelley's asked earlier, but I note on the discussion document on page 8, where it compares the different activity across each of the discussion document, that is, it compares the activity on new patients follow-ups. It would seem that Aneurin Bevan is quite atypical amongst all the other health boards. So there may be something here around what is the demand in Aneurin Bevan, or does that actually reflect the actual demand in Aneurin Bevan?
Yeah, I think by doing some of the work around the activity and comparing, it has highlighted some questions that we need to address and explore further, because there's nothing to suggest that we should have a disproportionate level of demand on our services. And therefore, that's why there's some more work going on around our coding of patients.
Yeah. And all those refinements have been picked up by the project team.
Yeah.
And that is why we're working assiduously on making it as clear as possible and being as accurate as possible before we come to any consultation. Emrys.
Okay, thank you.
Okay. Are there any further comments?
You're welcome.
Well, thank you very much for that, and thank you. The team have been absolutely great, and the cooperation between the health boards in delivering an agreement to go out to engagement in the first instance after so many years of not making much progress has been really, really good, and I'm really grateful to Nicola and her teams, and with Claire, and the planning teams in the other health boards who've all cooperated really, really well with the absolute endorsement of their chief executives. It's been a really good piece of work. So are we now happy that we adopt this engagement paper and allow engagement to proceed with the results coming back in May?
Yes.
Yep. Thank you very much, and thank you once again to the CHCs for their cooperation and help. If we can move on to items for assurance and start with risk, please, Judith, and can people put their hands down for the moment? Otherwise, I'm going to get confused here.
Thank you, Chair. Thank you. This is the strategic risk register for the board. The board will recall, in terms of our adjusted governance arrangements during the pandemic, and we have asked the Audit Committee and Quality and Patient Safety Committee to review the risks regularly, particularly in relation to the Health Board's COVID-19 pandemic response. And I know those committees have been providing a substantial review of all of the issues within the risk register. And I know at the last Quality and Patient Safety Committee, there was an extensive presentation around some of the areas that feature on the Health Board's risk register as they relate to the quality and patient safety of services provided by the Health Board. In terms of the risk register itself, you will be familiar with the process that we go through each time the risk register is reviewed. The key owners of the risks review them, and then as an executive team, we collectively review them as well and comment on the overall approach to risk. Within the paper, the cover paper, there is an extensive explanation of those risks that have increased and those that have reduced. I don't propose to go through them one by one, but if board members have any comments on them, clearly I or the senior risk owner will be able to answer those comments. Chair, as you will see from the risk report, we continue to manage a number of risks associated with the COVID pandemic and their impact on our service delivery and potential changes to the way in which we might need to modify and adjust as we go forward to mitigate some of those risks. One of the risks has reduced. So I'll just focus on that one, which relates to the uptake of flu vaccination by our staff, and we have seen, as you might expect, a higher uptake of the flu vaccination amongst staff this year. We still are pursuing to get it even higher, and we will continue to do that, but that risk has reduced since the last time the board saw the risk register. So other than that, Chair, I don't want to make any further comment because I think the report is quite clear and is self-explanatory in terms of the risks that feature on the risk register, but also those with an extreme severity score are also particularly listed. So, Chair, that's all I wanted to say in terms of introduction.
Thank you, Judith. Are there any questions to Judith? Shelley?
Yes, Judith, my questions aren't in relation to the cover report, because as you say, that's quite clear. But on the risk register that was circulated as part of the papers, I just had three questions or areas I wanted to ask, and is that okay?
Yeah, that's okay. I probably will bring the risk owners in if that's okay.
Fine, yeah. Okay. The one risk is CRR020, which is about WICIS and the implementation. And obviously there have been delays because of COVID-19, which is understandable. And I just wanted to know whether or not the milestones that were set in 2020 are still likely to be met because of those delays. And also it's mentions in the update about the ICF regional funding having not yet been completed in terms of allocation, and I wondered if there was any possibility of that impacting on progress.
Okay, Nicola, do you want to pick that one up? Thank you.
Yeah, thanks, Shelley. So the second question around the ICF regional funds, there was a regional programme board last week where Dave Street had received confirmation from Welsh Government that that funding is now going to be available in 21-22, so that enables our regional programme to continue as planned, which is great news. In terms of the broader programme, I think in terms of the briefing that we provided to the board last July, there were some delays for a number of reasons, and some progress has been made on the national product around, without going into too much technical detail, the Microsoft platform with which this product will rely on in June. There are also two integration items that we are finalising with NWIS and the software supplier. And we are planning to bring an updated briefing back to the board as a board briefing session in February, where I'm hoping we'll have a revised timeline which to enable us to go live this calendar year. But this will be subject to some of the ongoing conversations we need to have with NWIS and Advanced Hour supplier.
Great, that's lovely. Thank you very much. If I can just continue very quickly, CRR007, which is the fragility of the care home sector. And again, the update refers to the need for a review of the sustainability of the sector as funding levels will reduce significantly because of post-COVID, because obviously at the moment additional money is being put into that sector by Welsh Government. And what I was wondering was whether or not that review is now planned, so that, i.e. that the groundwork can be done now, so that actually when that funding is withdrawn, which I accept at the moment, we perhaps don't know when it is, but that we actually have a plan in place with partners to ensure that there is sustainability in that sector.
Yeah, thanks, Shelley. I'll bring Nick in because I know he's been in active discussion with our 5 local authority partners on this piece of work, which needs to be overseen by the Regional Partnership Board. Nick?
Yeah, thanks, Judith. Thanks, Shelley. I think we had a discussion actually only yesterday about the current financing of some of the care home sector and the need to avoid probably a cliff edge when we get to the end of this financial year, and how we manage potential funding solutions over the next sort of 3 to 6 months as hopefully the sector moves out of the current pandemic response. We've already raised at the regional leadership group the question of the market and its sustainability as we move into the next couple of years, and the regional commissioning group that sits underneath the regional leadership group has already started that piece of work in terms of defining a few models and also, I suppose, a likely demand and capacity scenario for the sector so that we can have that full discussion at the leadership group. I would suggest it's probably going to take place in the early part of Q1 of the next financial year.
Okay, that's really helpful. Thanks very much, Nick. And the last one for me, Anne, on this was CRR017, which is the complete or partial loss of health board ICT systems. And it's, again, the text says that these issues haven't been discussed at IGC, which is understandable because obviously the committee's suspended. But presumably these items have been monitored regularly with the exec team. That's what I just wanted confirmation on.
So the quick answer is yes, but
yes.
Nicola will give you the longer answer if you like.
Yeah. Obviously, this will get picked up as part of our risk reviews as under the executive team, but also based on any particular incidents or any planned incidents, they will be picked up on from an operational level up to executive team as required.
Yeah, that's great. Thank you very much.
Thank you. Rhiannon?
Thank you, Chair. I just wanted to raise within the cover paper where Judith rightly mentioned there was quite a bit of discussion at the Quality and Patient Safety Committee in terms of the risks. And it says that the risks are being reviewed and mitigated. I just felt we ought to add in as far as reasonably practical. I'm probably very mindful of the risk associated with infection prevention and control and reduction in nosocomial transmission, where obviously we've seen escalating risks and de-escalating depending on which part of the pandemic. So there's an incredible amount of work associated with the management of that risk, but has that risk been mitigated well as far as reasonably practical, but not completely. So it's just not to be pedantic, but important point. Thanks.
Yeah. Fair enough. Thank you. Are there any further questions on the risk register? No?
No.
Thank you. Can we move on then to the finance report, please, Glyn?
Okay, thank you, Chair. So you have a paper in the board pack which gives you an update on the financial position and forecast up to the end of November or month 8. Since that time, we've reported the month 9 position, which takes us up to the end of December. There'll be a detailed report on month 9 that will go to the February Audit Committee. But if I just give you some key highlight figures, and then I'll perhaps pick up some of the questions that have been raised by board members related to the finance report, if that's okay. So in terms of the month 9 position, in terms of our revenue budget or revenue resource limit, month 9, we were reporting a surplus of 467,000, so a slightly smaller surplus than at month 8, but it's broadly there or thereabouts. For the end of the year, we're forecasting financial balance, and obviously that is based on a range of sort of assumptions around all of the services that we're currently running, the workforce that we're employing to run those services. And clearly there will be some risks and opportunities around the financial position in terms of flexibility there. In terms of capital, the report for month 8 highlighted a potential deficit. However, this is more related to the fact that we have still been working through what the final costs of opening the Grange early were, and also the costs of increasing some of our surge capacity on other hospital sites. Since that time, and actually since we reported the month 9 position, we've had additional capital funding confirmed by Welsh Government, which has increased our overall capital funding for the year. And that includes an updated level of funding to cover the costs of opening the Grange early, but also a lot of the other COVID-related capital spend that we've incurred. So some of that's around upgrading some of our other hospital sites. Some of it's around purchasing additional equipment as well. So with that in mind, we're reasonably confident that we'll be forecasting a balanced position on our capital as well. There are still one or two areas where we're still negotiating funding with Welsh Government for this year. Some of it is around the satellite radiotherapy unit. So the business case, as Nicola mentioned earlier, has been approved, and we are just trying to agree funding this year for some of the early work and professional fees. It's about £400,000 this year. Similarly, we're negotiating some additional funding around work on laminar flow for the theatre in Royal Gwent. So those amounts haven't been confirmed yet, but we would hope to sort of finalise those in the next couple of weeks. So with that in mind, I think we've got enough flexibility within the capital programme to manage within the capital funding that we've secured. If I just perhaps now move to some of the questions that have been raised. So hopefully I'll try and cover off everybody's questions that have been picked up. The first one that I just wanted to pick up on was around annual leave. So this is about staff who by the end of the year won't have taken all of their annual leave, and given this is quite an exceptional year with the pandemic, but I think also for our health board, opening the Grange University Hospital early has meant that in some cases staff haven't been able to take their leave in the normal way that they would do. It does mean that potentially we will have more staff taking or asking to carry forward more annual leave into the next financial year. And if you look at sort of current sort of government guidance around COVID and annual leave generally for employers and employees, there is probably more flexibility and acceptance that staff may wish to carry over more leave, but really on the basis that they would then try and take that back within certainly a 2-year period. So with that in mind, there's a financial impact of doing this. We're working with our workforce colleagues. We've looked at the various different workforce systems that we've got, both in terms of e-rostering and where people book annual leave on various workforce systems. We've come up with an estimate of the financial provision that we think we will have to make for this year. The current estimate is about £20 million. Now, that obviously sounds quite a lot. It broadly equates to probably somewhere between every member of staff carrying forward about 8 days annual leave. But the value of that financially is about £20 million. We've been in discussion with Welsh Government about this. Other health boards, you won't be surprised, are in similar positions. So we've shared these estimates with Welsh Government on the basis that we would be looking to secure financial cover for that for this year. We're still awaiting for Welsh Government to actually formally confirm that, but at the moment we are assuming that there will be financial cover to be able to make a provision for that annual leave. It's also quite important that we all, as health boards across Wales, agree a consistent methodology. So we're also working with Audit Wales to make sure that there's not only a consistent methodology, but that every organisation can measure and take an annual leave in a robust way. So it does rely on having good, robust workforce systems that are used by all of our staff. This is something that we will probably pick up in the audit committee in a little bit more detail, but I just wanted to bring this to people's attention, and I know it was a question that was asked by one of our board members because potentially it's quite a significant risk, but I think it's one that we've got to try and work through practically with Welsh Government and Audit Wales, in the knowledge that staff naturally won't be able to take all of their annual leave because of the pandemic. So I would hope that we can come to a common sense approach that is sort of acceptable to everybody for this financial year. If I then pick up on, so I know that there was a question around underlying financial impact. So what does that mean going forwards? Each month when we report quite a detailed set of monitoring returns to Welsh Government. We identify what the underlying financial position is for the Health Board. At the start of the year, it was around about 11 to 12 million pounds underlying deficit. That has increased during the course of the year to about 21 million. So if you look at our underlying deficit as we go forward to future years, we have a potential 21 million pound deficit that we need to address. Now, the two main areas that have contributed to that are, first of all, savings that we plan to deliver this year that we haven't delivered, and again, primarily due to the pandemic. So you will see in the paper that we originally planned to save around about 33 million pounds. Our actual savings are likely to be around 11 million for this year. And the other area that will have contributed to that, and in some ways they're also interlinked, is that we have invested additionally in the hospital network, so the opening of the Grange, but also developing the services at each of our enhanced local general hospitals excuse me, has meant that actually we potentially have an increased underlying financial deficit, which we will need to address as we go into next year. Now, the potential flip side to that is what we have seen this year is there are a number of areas where we've avoided spending money. Now, some of those relate to elective care that we provided or not provided this year. And as a result of that, we've avoided spend of around about 40 million pounds this year. So when you look at how we've sort of achieved a balanced position this year, there are a number of components there. Clearly, we haven't delivered on the level of savings that we planned to do, but we've avoided spending money in areas because we haven't delivered some of those services. Now, going forwards, we know that we will have to resume some of those elective services. But I think what it does do is it presents us with an opportunity to critically look at what we are spending on some of our elective services and whether that is delivering good outcomes for our patients. And as we look to address some of the waiting list backlogs, whether there are better alternatives in terms of both improving outcomes for our patients, but also making better use of resources. So as we currently reported at the moment, we're reporting that underlying deficit position of 21 million. But as I've tried to explain, hopefully fairly succinctly, there are a number of variables to this, which I think will allow us to look at how we address our recurrent financial position going forward. If I can just pick up on a few more of the questions that have been raised, if that's okay. I know there was a question raised around CHC funding. I think it relates to the question that was highlighted before around care homes. But just for people to be aware, we have received non-recurrent funding this year from Welsh Government to support the care home sector during COVID-19, and that is specifically time-limited funding around the pandemic. So at the moment, we've been given that funding for this year. It's not clear what COVID funding will be available for next year, but I do think we need to work on the basis that that will be time-limited funding. And I think it links in to Nick's response earlier about working in partnership to come up with a sustainable model, which is financially sustainable as well for that sector. I know we also had a question raised around outpatient transformation, which I'll be honest with you, I probably can't answer in full today. I think it was trying to tease out what the impact of some of the outpatient transformation work has had on our workforce and also financially. What I can share with you is that in terms of virtual consultations, which would include outpatient care, if you look at the period April to September of this year, for Aneurin Bevan Health Board, we undertook over 19,000 virtual consultations. For the whole of Wales, it was around about 53,000, I believe. So you can see that in Aneurin Bevan Health Board, proportionately, we've undertaken a far greater number of virtual consultations. Now, the services that we've undertaken most of those are in would be mental health, children's services, and also our GPs in primary care. So that's where we've seen the biggest increase in those virtual consultations. And I think really part of the plan going forward is to not only sustain that, but try and look at where we can achieve a better balance of face-to-face outpatient consultations and virtual consultations going forward. But we very much benefited from that early digital investment that was made early on this year. And I know that Welsh Government are holding funding for next year around digital investment as well. So I think it's important that our plans going forward look at how that sort of mix of face-to-face and virtual consultations can work going forward. We know that in some services it's really important to have the face-to-face contact when you're dealing with patients and carers. So the balance is really important from the point of view of patient experience and getting the right outcomes. Did you want to take some questions?
Yeah, please. Claire, did you want to add to that?
Yeah, I just wanted to follow up on Glyn's point around outpatient transformation, really. The directorates have done some really good work and really taken the opportunity, I think, right from the start of Surge 1 about trying to do things differently. And we've really done some good work that we've been struggling to do for many years around outpatient transformation. So some of that was quite welcome. And we're putting in quite a lot of challenge around not going back and doing things in old ways. So really embracing some of the learning from this. And also doing some work with patients to understand what it feels like and what they are reporting back to us, and some really good feedback in terms of PREMS measures around that. We've got quite a focus on structured outpatient transformation work, which is we've got a senior manager leading, but we've also got Caroline Mills clinically leading that. And we've got some really challenging outpatients, particularly follow-up targets to deliver. And we're having some really good clinical engagement with on a directorate by directorate basis, because people know that we've got to absolutely transform to get our outpatients list into a safe place, let alone around waiting time. So yeah, a lot of challenge ahead and a lot of education and support about new ways of working, but directorates have really risen to the challenge.
Thank you very much, Claire. It's really good to hear that. Paul, did you want to ask something?
If the report's been completed, then I'm happy to say so. I just wanted to say something at the end of the report.
Oh, all right, fine. No, we haven't finished yet. Carry on, Glyn.
Okay, thank you. So there was a question raised about sort of wider new ways of working. I think Claire's probably answered part of it. It's quite a wide-ranging question, really, though, in terms of new ways of working, because it relates to a number of our services, but also the way that a lot of our support services operate as well. So again, I don't know if we probably almost need a separate session on some of the new ways of working.
I think that would be very useful.
Yeah, I think in the context of our use of resources, again, we'd probably need to look at some of those in further detail. Again, what I've tried to draw out in the report are some of those areas where we've seen some obvious reductions in costs. So, for instance, on travel expenses, we've seen a continued reduction in the amount of travelling expenses that we incur, and we believe that will probably increase to about £800,000 this year, primarily because people are travelling less. We're doing more, as we are this morning, via sort of Teams meetings and Zoom meetings, and we are working quite differently, and it will be important that as we go forward we strike that balance between, you know, what are appropriate face-to-face meetings and what are meetings that can be sort of carried out virtually going forwards. But clearly there is a financial benefit to it as well, because of that.
That forward in a board briefing session with agile working update, please.
Yeah, that would be great. Thank you. I'm almost there. So just picking up on the savings approach. I know a question was raised about our savings approach for next year, and again, I'm conscious that we'll have various committee and board development sessions to talk about the approach, but I thought it's probably worth just sharing briefly with the board how we're taking that forward at the moment. So the annual plan for next year will look at a number of key priorities, focusing on pathways of care, so patient pathways, and focusing on how we improve health outcomes. So our savings approach, I think, is really important that our savings approach is aligned to that and to those principles. So it will be really important that the value-based healthcare work that we've talked about this year, so we identified this year priorities around MSK and eye care. It's important that we accelerate that work, and I know that some of that progress has been limited a bit this year because of the pandemic, but it is really important that we apply those value-based principles to the way that we prioritise and deliver care along pathways, and that we're able to measure the outcomes, and that will help us both invest in the right areas to improve outcomes, but also look at where we can potentially disinvest, so that we're making better use of those resources. So I think our savings approach going forwards clearly has got to be value-based approach. We've invested significantly in the hospital network this year, so the opening of the Grange, but also establishing the enhanced local general hospitals. Clearly that's been of real benefit as we've managed our way through the pandemic, but I think as we come out of that, it will be really important that we see improvements in performance across our hospital network, which will drive both improvements in effectiveness but also efficiency. So again, that's another key part of the savings approach. And then I think probably the third area for me is that we will always need to focus on those operational efficiencies and variation. So looking at things like procuring goods and services more efficiently and more effectively. And again, there's probably more we can say on that in a separate session. But also in areas like effective medicines management. And there was a recent annual prescribing report that was published looking at a number of key indicators on effective prescribing across each of the health boards in Wales. And again, I think it gives us some opportunities to improve both in terms of efficiency and effectiveness there. So I think there's a number of strands to our savings approach which need to be linked to improving outcomes for patients, but should then allow us to reallocate some of the resources that we free up as a result of saving money. And obviously we need to be mindful of the fact that we've effectively committed resources ahead of delivering some of those savings, which is why we're talking about having an underlying deficit position. So each of those components really does need to deliver on those efficiencies. So the final point from me, which I just wanted to pick up again on some of the questions, was around some of the risks and opportunities. We stated that two of the key areas, one was the annual leave provision, which I've covered. The other one was around any potential changes in what I've called government policy, which could be changes in national guidelines. Now, we haven't necessarily quantified these, but it was really just bringing to the board's attention that in setting our funding levels and agreeing those with Welsh Government, it was on the understanding that if there are any material changes to things like the mass vaccination programme or the way in which we're doing test, trace and protect, if it had material resource implications, we would reserve the right to go back and negotiate the funding implications with Welsh Government. So hopefully that just explains the comment around some of those key risks. I think I've covered all of the questions, but if I haven't, I'm happy to pick up any that I haven't covered or any other questions that have arisen. Thank you.
Thank you very much, Glenn. I think that was quite clear. Are there any further questions?
Yeah.
Paul?
Just to say, I thought this was an excellent report, Glenn, and when we look back over the last 12 months, these have probably been the most difficult that this country has faced over many, many years. So therefore, the fact that we're in a break-even position locally, or potentially in that position, I think shows the superb work that you and your team have been undertaking to ensure we're at that stage. When we look at the next 12 months, we are looking at some increased capital programs. We're looking at the flexible leave approach. We're looking at some real sort of opportunities and creative and innovative opportunities with regards to learning from what has happened during the pandemic, and virtual surgeries and all those sorts of things, and meetings can really save time. They save resources as well. So that's encouraging as well. And I just also wanted to, besides thanking you, I think an opportunity to say thank you to Welsh Government, because they have provided additional resources at this very difficult time to ensure that our service is efficient and effective, and we end the year on a break-even position, which I think is remarkable, bearing in mind all that's happened and this unprecedented pandemic, and the opening of the new hospital, which is a once-in-a-lifetime event, and secondly, the workforce situation. So I just think this is a remarkable position.
No, yeah, thank you, Paul. And I would echo your comments about Welsh Government support. I think it's been really helpful, particularly earlier on in the year, to give us some certainty and really allow us to just sort of focus on the operational response around the pandemic. And I mean, it always comes down to this being a team effort, really. And so I think credit to the whole team involved, really. Thank you.
Thank you. Thank you very much, Glenn. Can we move on to performance then, please?
Okay. Thank you, Chair. So you have the performance report in the pack, which generally takes you up to the end of November in terms of performance measures. What I've included in the report this month is a little bit of context around the reporting requirements with Welsh Government at the moment. I think it's been important that we've maintained our sort of reporting to the board during the course of the pandemic, despite or sort of irrespective of whether there's a requirement to publicly report some of the performance figures. The report sort of highlights a number of areas where you will have obviously seen that access to some of our services has been affected during the pandemic, and particularly focused on areas like stroke care and cancer care in the report. I also thought it was probably important and helpful to provide some context around some of our mental health services and access to some of those as well. Again, I know that there were a number of questions that were raised around different aspects of performance relating to our services. I will try and answer some of those. Some of them we probably don't necessarily have all of the evidence and information on at the moment, but we will actually look at that sort of over the course of time. I know there were questions raised around cancer referrals and whether some of the impact was affecting later presentation of patients. At the moment, I'm not aware of any evidence that patients are actually presenting later, and if so, what the consequences are. But that is something that we are having a look at, because clearly it is important that we are still able to provide timely access to cancer services. I'm not at the moment clear as to why we're seeing significant increases in referrals for colorectal and breast cancer. But again, that's something we will need to do some work on to understand. As far as stroke care is concerned, I mean, just to say that the hyperacute stroke unit is still in the Grange University Hospital, so apologies if the report was a little bit confusing there, but that is still being provided in the Grange University Hospital, even though we've had to temporarily change one or two of the services around in the hospital. And again, I think it's probably fair to say at the moment, we probably don't have any long-term outcomes on any delays to stroke patients at this stage. But again, it would be something we would need to have a look at going forwards. As far as mental health is concerned, I think I've picked up on the question around getting the balance between virtual and face-to-face consultations. Clearly, it is something that we are still working on, and I know that we are getting feedback from patients about how they're finding that service in terms of a more remote service during the current environment. So again, if I can perhaps pause there, if there are any questions that people feel I haven't covered off properly or any new questions, happy to take those.
Any further, Tish?
Thank you, Chair. This is a related question. I noticed that the CHC have published their report, Feeling Forgotten, which, Angela, thank you, just to extend thanks for that, because it really does give an insight to how patients are feeling during this time. And I think, and clearly the whole situation is very difficult. We're trying to balance everything, aren't we? But a message that comes through consistently is around communication, and where patients aren't able to have their needs met. Again, it's very difficult. We're not going to be able to do what we were, but they don't feel communicated with, and they're not clear, about why necessarily that their treatment isn't being continued, or they worry about the impact. And I'm just wondering how we are incorporating the messages and the feedback in that report and from patients generally around this particular area.
Ria, I think you'd like to comment.
Yeah, thank you. Thanks, Tish, for mentioning that. We did receive an update at the executive team on the Feeling Forgotten report, and we've got an agreed approach locally with a few of the clinical executives and the person-centred care team to put in a local plan to address the findings, which we will naturally bring back at a later date.
Thank you. Thank you, Tish. Are there any further questions to Glyn? Well, just a comment from me. Obviously, the waiting list performance at over 36 weeks is a matter of enormous concern, and we know why it has occurred. And I note the action plan that you are undertaking to address this, which will come back to the board, and also in respect of the emergency department and the work that is being undertaken to look at the reasons now behind any adverse delays. And I understand an audit into that is going on at the moment. So just to add that to the understanding of the board. If there are no further questions, could we go on to the annual plan, please, Nicola?
Thanks, Chair. So it's just a short paper to update the board on our planning process for 2021-22. As you're aware, our IMTP process is still paused, and there's a requirement now on health boards to produce an annual plan for 21-22, required to be submitted by the 31st of March. So the annual planning framework that have been given by Welsh Government kind of tries to recognise the balance between meeting operational demand on the ground and also trying to stabilise and recover around COVID, and we're recognising, I think, that there's still a lot of uncertainty. And it's shorter than the traditional IMTP guidance, and I think an expectation that our annual plan will be shorter, and acknowledges there's going to be a need for flexibility and agility in our planning, given the continued uncertainty we face going into next year. To support that kind of shorter annual plan focus, there is an expectation that we will do comprehensive minimum data sets around our demand and capacity, workforce and finance as much as possible with what we know, to underpin our business as usual. We've had a discussion as an executive team as well, and with some of our divisions, and are keen to keep this process light, particularly for our operational teams and our frontline staff, but also keen to make sure they are involved and engaged and get the opportunity to feed into this. So the plan is we'll have 2 products. We'll have a narrative, a fairly short, concise narrative document, which focuses on our purpose and priorities and some of the kind of priority themes we want to focus on. And we will have the demand capacity analysis and the minimum data sets, which will give more opportunity on the detail and the business as usual elements of our work. So we've already had various discussions with some of the operational teams, with more ongoing this week. We've also met with RPB colleagues to make sure we are approaching this as much more of a system plan, and a real opportunity to kind of construct the way we do our planning. We've got a planning committee next week where we have a bit more discussion on this as a board, and we've also got a session with the CHC and staff side planned as well, to make sure that we get some feed into these into this plan for next year.
Thank you, Nicola. Yeah, thank you. Shelley?
Thanks for that, Nicola. And obviously next week, as we get a bit more detail about it, but there was actually there were 2 points. I did raise one before, but one's just occurred to me. On the actual document itself, just sort of on the first page or so, second page, it talks there about the plan looking differently from previous years and focusing on understanding its challenges, risks and priorities, and then the key enablers to how the organisation will deliver rather than on specific actions. Does the guidance sort of, are they talking about here focusing on outcomes? Is that what is it a move towards that rather than perhaps in the IMT, which is more, I just wondered about that. And my other question, so you can deal with, was just a question, later on you talk about engagement with, has already begun, and you talk about the regional partners and the regional partnership board, but I wondered whether or not there would be any engagement as well, bearing in mind timescales, I appreciate, with the third sector and maybe some of the wider public service board partners in relation to this. Thank you.
Yeah, thanks, Shelley. And I think it's been quite good already this year that we've had some early conversations with the RPB. I take your point about the PSBs and the third sector. I don't think we'll manage to get all of that covered ahead of the board, but I think what we can do, given this very much a framework, it will enable us to engage with partners as we move to implementation of the plan. And the third sector in particular and other key partners will have all been involved in some of the projects and programmes that you'll see within the plan's priorities, such as the Iceberg programme or young adult mental health, those type of areas where third sector play a large part. So we will be doing a check throughout some of those priority programmes to make sure we have had the right engagement. And then in terms of your point around, so we are trying to do it different. We are trying to take this as an opportunity to kind of reframe our system priorities and really look at this in terms of with partners, what are the areas, and taking very much a life course form. We then try to identify the key enablers, and also we will try to introduce how we measure and be much clear about how we measure delivery of those priorities, which will encompass some of that outcome focused approach rather than some of just the traditional methods. So we've had a discussion this week with the execs and and outcomes, and that taking that perspective is really important as we develop this plan.
Thank you, Nicola. Thanks very much.
Thank you. Are there any questions? Could I just ask, please, then, Nicola, why is Welsh Government not going to formally assess the plans? Is it time, people?
I'm not really sure. I think it's probably in the context of the annual nature of the plan and the changing circumstances. But
fine, okay.
I'm assuming we will have some informal feedback.
I would have thought so, and I think that would be welcomed.
Yeah, and they've done that on our quarterly report, quarter 3, 4. We had some helpful feedback and reflections from them rather than a formal assessment.
Oh well, I think that would be very helpful indeed.
Yeah. And we've been working with them. We've been in dialogue, sharing some of our thinking about how we're planning to develop the plan for next year, just to ensure, you know, we're on the right track. There's nothing, you know, and it is important to get that balance between making sure we meet the requirements of Welsh Government and we develop a plan that meets what we want as an organisation and as a system. So trying to get that balance right is quite important.
Yes, absolutely. I agree. Are there any further questions?
No, seems proportionate. Well done.
Good, thank you. On then to quarter 3.
Okay, thank you. Should be fed up for listening to me now. So this is an interim report against the quarter 3 4 operational plan that we produced in early October and submitted to Welsh Government. And it focuses on some of the key headlines for quarter 3, some of our key achievements, some of the key challenges we faced. It's interesting actually when we've reflected back on this report, which was only about 4 to 5 months ago in writing, and it feels like it was forever. There's so much changes so quickly. And it just demonstrates the complexity of the circumstances we expect to plan and deliver our services. I think in terms of the context for quarter 3, we did see a rise in community transmission and incidence of COVID beyond what I think we expected and earlier than we expected, with a second wave hitting us greater than again we anticipated. And you know, the NHS becoming overwhelmed in particular around December. I think that this all happened at a time when we were trying to then start a significant undertaking around the vaccination programme that we've talked about, and also seen an unprecedented level of staff absence, you know, linked to the success of our testing, TTP, but also the increased transmission, which obviously affects our staff. So I think that was some of the challenges that that hit us really a bit harder than we anticipated. So I think just picking up some of the headlines in the report, I think picking up on the TTP, I think, you know, considering it's a service this time last year we didn't even have in place, they've done a tremendous job in being able to, the success of some of their contact tracing in such high volumes of community incidents has been really exceptional. And our testing sites and testing capacity again, has not been an issue of concern and has met the demands of the population exceptionally well during the quarter. I won't go into detail on the vaccine programme because we've covered it, but again, the requirements on our workforce in amongst all these other challenges is really quite unprecedented, really, and we've done so well to get to where we are. I think in terms of the essential services, you know, we have continued to maintain our essential services as set out by Welsh Government, you know, and continue to meet our urgent surgery, our urgent cancer, those areas we identified as essential to keep running. And we were, you know, there was exceptional amounts of planning that went into being able to restart some of our elective work during quarter 3, which we actually did get about 3 weeks out of. And, you know, every patient counts here. So we increased our numbers from about 60 to 150 for about 3 to 4 weeks, you know, and got as many patients as we could until we were in a position really where we had to stand that back down because of the increase in COVID numbers that we were seeing and the need to redeploy staff. But I think it is important to recognise we did re-establish surgery, and we have got well planned out green pathways now that we can enact fairly quickly when we are at the right point to do that. We did a report at the last board on the opening of the Grange Hospital, so I won't repeat all of that, but you know, we can't not recognise that in quarter 3 and amongst that context we did open the new hospital to help with all the challenges we were facing, and whilst it brought some new challenges for us to introduce this new system in amongst the pandemic, it has given us huge flexibility during quarter 3, you know, during the last few months, and even in particular when we consider our critical care numbers now, we are benefiting from the surge plans that new hospital offers us, staying within the footprint of the critical care department with a centralised workforce has been of huge benefit, as well as the evidence that we are seeing on the reduced nosocomial spread in a hospital which has single room environment. So that's really good. The urgent primary care improvements, again, that were enacted during Q3 alongside the opening of the Grange, both in terms of the flow centre getting into operation and the urgent care centres at the Royal Gwent and Neville Hall, and the phone first in terms of us getting ready to do a full launch in Q4, hopefully when we are ready. But it's enabled us to really kind of get do a soft launch and start understanding some of the issues that we need to get right before we fully launch that service. We talked a bit earlier in Glyn's report around digital and new ways of working, and the first wave was pretty challenging and has continued for the world of digital, for the continued need to do virtual working, and also more people needing to work from home in the second wave as the community incidents increased and so on. So I think they are the things that we've done particularly well, but it's also important to recognise what really did challenge us in Q3. And there's a little section in terms of we knew trying to predict what was going to happen with this pandemic was exceptionally difficult, and trying to get national modelling again had its own challenges. And there were a number of national models about at the time, and the recommendations that we used, the Swansea University model at that time, which underpinned some of our planning in Q3 and 4, where we predicted we'd hit a peak of 300 COVID patients, where our occupancy peaked on the 22nd of December, where we had 490 occupied beds of COVID, plus 123 recovering. So it exceeded by some number what we thought was the most likely scenario. So obviously that has required us to respond quickly. But fortunately, the government interventions they have taken, we have seen a slow-in since the 1st of January, and that is continuing to reduce. We briefly mentioned critical care just now, but we assumed a demand range of 17 to 25 critical care, and we've hit a peak of about 25 COVID patients in intensive care and 7 non-COVID. But this time is really important to identify that we had at one time 14 patients on our respiratory ward receiving high care, which in the first wave we would have had in an intensive care environment. And those teams have worked exceptionally well together to try to manage patients appropriately based on their learning from this disease, and making sure that we optimise our space and our workforce to best deliver this care. So again, I think that really was a challenge for us at a time where we then seen a reducing workforce beyond what we expected. I briefly mentioned the nosocomial transmission, which again was a huge challenge for us in those early months as the community incidence and transmission was increasing. And I think our advancements in testing has enabled us to identify patients much quicker, but then brought the challenges of making sure that we could isolate exposed patients. And we introduced a comprehensive COVID pathway plan, recognising we needed to treat the different streams of patients in different ways, which was a very important introduction for our infection control plans. And we have seen the benefits of that since we introduced it, but does bring added complexities for our capacity planning when you are then trying to manage patients across various sites in the different categories. And we've also reinforced continually the importance of, in all of our both hospital and non-clinical environments, making sure that we are protecting our patients and staff, social distancing, PPE, hand hygiene, and so on. Obviously, we've had some very successful campaign development. I've mentioned the staff absence a number of times, and Judith referred to it earlier as well, in terms of the number of people that we have had who have not been able to work due to either self-isolation, shielding, or sickness, which has been a huge challenge for us at a time when we already had high levels of vacancy. So I think, in that context, we've done exceptionally well to get through the last 3 months with some of those challenges. Our priorities for Q4 is about trying to increase the resilience in our system through our new reconfiguration of sites. I think as the COVID presentations now reduce, we have got to take this opportunity to get the new system embedding well. And we have put in a particular plan for the winter, which is very focused on getting the right patient at the right place at the right time, with some enhanced leadership and focused actions in trying to improve that. Obviously, we've got to continue with the vaccine rollout. We know this is a huge undertaking, and the challenges of supply and regulations and so on is going to be an ongoing issue for us that we need to plan and prepare for a while yet. And then just to reinforce, employee wellbeing continues to be high on our agenda, as Judith mentioned. And I know Geraint and his team are looking at opportunities, and there's a plan due to come to us about how we can enhance our support even further around the staff wellbeing. And this will be a key priority for us going into 21-22. So that's a bit of a summary of the Q3 report, and we'll give a fuller summary at the end of Q4.
Thank you very much, Nicola, and thank you to all our staff and colleagues who've helped us get through Q3 with good results, given the very difficult circumstances in which everybody has operated. Are there any questions?
Yeah, could I just say that I was incredibly impressed to read the last section about this concept of developing a well-being for the workforce in the education centre, and this being a centre of excellence, and to use research. I think it is about future-proofing situations, and I think that is an excellent idea, and it'd be good for us to have a briefing on that.
Yeah.
Things have actually been completed, because part of our role is having a duty of care over all of our staff that work within the organisation and the support, etc. And I think this is that, together with the information Lynn mentioned to do with the flexibility of staff leave, which is we are listening to staff, and we want to try and help and support them in all ways we can. So I think that's an excellent idea, and look forward to hearing more about it. Well done.
Thank you. Thank you, Paul. Glyn, did you? Not Glyn. Geraint, did you want to add anything to that?
Yeah, just to thank Paul for those comments. I think we are excited about the prospect of a wellbeing centre of excellence. We're already in discussion with Welsh Government about our plans and how they might help us in that regard. So yes, happy to come and brief the board in terms of our progress on that.
Good, thank you. Well, we look forward to that. If there are no further comments, can we pass on to the key matters from committees? Are there any issues that the chairs of those committees would like to add? Emrys? No? Okay.
Nothing further from me, Chair.
Fine, thank you. Could I just ask one thing about WISC and the detail in that? Do we know when we're going to have the first outcome report on whether or not the major trauma centre, even in these very difficult times, is making headway into achieving its objectives? Nicola, do you know when that's planned for?
No, I haven't got a specific date, Anne, but I can pick it up as part of our planning discussions.
Right, thank you. Thank you very much. Are there any questions on the committee reports? No, and I thank the chairs for keeping going in difficult circumstances to ensure we maintain the governance of the organisation. If nothing further, might I remind people that the next meeting will be held on the 24th of March at 9:30. Thank you to those who've stuck with us on YouTube for listening, and I hope you found it helpful. Thank you to my colleagues on the board for their helpful questions and their interest. And we will have you'll be glad to hear, 5-minute break or 7 when we go into a short private session. So we'll see you in a moment. Thank you.